Alright. I see we can go down.
Wow.
We can go up. If you want to be up, you probably want to scoot up just a little bit so your butt's right in the center. There you go. So, you know, if you were a patient, Noel, somebody might take your blood pressure. You know, I don't know if you've ever had that done, but it doesn't hurt. It just squeezes a little bit, and then they listen, and then they let it out so it doesn't squeeze. And then they just kind of know how you're doing.
This is what happens if you get picked up by an ambulance. Then you would be in there, sitting on the gurney.
Hey, look,
show you the pulse
if the patient has a fever and at least one of these other symptoms, the patient has an influenza like illness by definition. Take the following infection control measures. Offer the patient
You got some good eyes.
a Proketer surgical mask and instruct them to wear it while in contact with healthcare providers. Patients who are unwilling or unable to wear a mask shall be offered a tissue or non-sterile 4x4 and instructed to cover their mouth and nose while coughing or sneezing. EMS providers should utilize
Oh, come sit down with Tito Christmas. Oh,
patient contact. Decontaminate all appropriate equipment following patient transport. Get it? Gel in and gel out. If the patient is alert and able, offer to squirt hand sanitizer on the patient's hands. Don't forget to wash your hands often.
It's true. So no, check it out. Feel these. They just feel normal, right?
Yeah.
You can hold them. You can squeeze them in your hand. So they got chemicals in them, and sometimes we need cold and sometimes we need hot. So let's see if we can get these to work. Squeeze. You can read that, right? Squeeze outer. Oh, you can read it.
Squeeze outer edges towards center from arrows.
Okay, so let's see if we can. Oh, okay. And then we'll shake. Ooh, now feel it.
Ooh,
it's cold. You want
really?
feel it?
Francisco, feel it. How does it feel, Francisco?
Here, baby. Touch it like this.
How does it feel, Francisco?
Nice.
So this one's supposed to get hot. Let's see if it says the same thing. Squeeze outer edges towards center from arrows. Does this feel hot to you? Not yet, right?
No.
Does it feel hot? Just kind of normal. Let's see if it'll work.
Instant cold.
Instant cold. This one is a little tricky. Ooh, I hear some
Hey,
kids.
look. Hey, look. Refrigeration.
Oh, feel it. Francisco, feel the hot one.
Hey.
How's it feel, Francisco?
Yeah.
Hey, look. Look. Refrigeration prior to application may result in frostbite.
Oh, no,
Wow.
that's too cold. That's too cold.
Well, what would happen with the hot if it were that too?
If it was too hot, you get burned.
But these shouldn't, they're not supposed to hurt you. They're just supposed to be a little hot or a little cold if you need hot or cold. They're not supposed to be too bad. So here's how
they're not too bad.
Yeah, they're not too bad. So here's how this works, right? Like, there's so much stuff on this ambulance. If we had to count it every day, it would take too long, huh? So, if this is still sealed,